So many people are here, and Dr. Ashok Seth live with us too. Let me put this question to him. You know, Dr. Seth, so many people I meet these days who tell me the best way to stay fit, the best way to be slim is just don't eat dinner. Give up dinner. Have lunch, have breakfast, please don't eat dinner. Or do these all kinds of, keto diets, extend the gap between your meals. When you embark on these journeys of playing with your body, do you ultimately end up damaging your body? Could that be what may well have happened to Siddharth Shukla in his attempts to just look good and trendy?
See, we're very sad about his passing away at this young age, and it's shocked us all. So therefore, I don't want to reflect on him.
Yeah, sure.
But I do want to reflect in general and make the public understand that's true what you said. Fad diets are temporary. They'll give you temporary, but they could be damaging much of your body in a very unnatural manner. In fact, we've just realized in medical science and for body health that extremes are bad. Moderation is all that you need. In fact, when we talk about muscle building, body building, that in no way relates to cardiac health. You can be the most muscular person, but you can actually have really bad coronary arteries. And that is why, unfortunately, we have those situations.
Do we need to have, like diabetes, Dr. Seth? So much of conversation took place around diabetes. People take care about what's the quantity of sugar, etc. that you take. Do we talk enough about the state of cardiac health in India?
I think we talk enough about the state of cardiac health, but I don't think it percolates through. It's almost like seat belts. If you drive a car fast, you're more susceptible to accident and you need to put on seat belts. But there are numerous people around who just don't even believe that seat belts are needed till they actually have an accident. By the way, just let me tell you, India as a psychology of the Indians, we're not proactive, we are counteractive. Most of my patients do not take care. They actually start taking care and precautions. A lot of the cardiac patients start taking care and precautions after they have an heart attack. For example, we have patients coming to us whose family tells them that अब ये इन्होंने तो बिल्कुल सादा खाना शुरू कर दिया, अब इन्होंने exercise कर दी है, and I say इनका खाना अलग बनता है. They say yes, हम तो वही खा रहे हैं, इनके लिए अलग बनाना शुरू कर रहे हैं. And I wonder why that healthy diet is not being had by the whole family, and why is a healthy diet thought to be something for a bimar and not for being healthy.
Also throw some light, Dr. Seth. How much of the nature of your cardiac status, your cardiac health, how much of that is in the mind, mental stress, and how much of that is to do with alcoholism, tobacco consumption, and the kind of food that one consumes?
So it's so important. Tobacco is the biggest cause. Well, family history, tobacco, and diabetes form the first three. And that is why I would say that there are people who come to me and say, I've done everything right. And by the way, it's not unusual for us to see a 40-year-old with a heart attack. We deal with heart attacks on a daily basis because we treat the heart arteries. Now, but the unfortunate aspect is when we actually see a gentleman who could have avoided it, who unfortunately had a family history, and that's something you can't change, and who says, I've done everything right, I've exercised, and I'd actually eat well, and I just eat carefully, and I try to relax, and I go on regular holidays. And then you say, but I noted that you actually smoke. So how many cigarettes? Oh, but I smoke only 10 cigarettes a day. But that actually undid everything he was actually doing right. And on a top of a family history, if there's smoking, the family history makes him 3 times increase to having a heart attack compared to the normal population, or 4 times. You add on smoking to that, you actually had 10 times increase in the tendency of a heart attack.
Okay, Dr. Seth, just hold on.
Multiplication factor.
Multiplication factor.
And by the way, there are many other factors that we need to understand.
Yeah,